Okay. Good morning, everyone. Thank you for joining us for What Families Need to Know About Drugs for Their Student with Disability webinar. Today, we are joined by Tiffany Little. She is a licensed professional counselor and certified substance abuse counselor who holds a Master of Education degree. She is the Senior Substance Abuse Prevention Specialist, SAPS, for FCPS. Prior to working for FCPS, she was a substance abuse therapist working in the Adult Detention Center with incarcerated men, the mental health therapist for three state probation offices for the Department of Corrections, substance abuse therapist for the Marine Corps, and she has worked with children in therapeutic day treatment programs. Her primary role with FCPS is to support the team of 22 substance abuse prevention specialists and provide program oversight for the district. Tiffany, please take it away.
Thank you, Amal. Hi, everyone. Thank you for attending today's session. So my name is Tiffany Little. I'll be with you all. The chat is open for you to ask questions throughout our time together. My only suggestion is that any questions that you have, make sure that they pertain to the information that's already been shared, because your question might be answered later on throughout our presentation. So this is our agenda for today. We're going to do some basic information about alcohol and nicotine, opioids, and cannabis. I'm not going to give you all too much information about the science of it and how it affects your body, because you can easily Google that information. We'll talk about medication safety practices with some recommendations, how drugs end up interacting with one another, and some mental health medications, including ADHD. We'll talk about autism a little bit, but our primary focus will be on drugs in general and then ADHD. And of course, we'll talk about some prevention and coping. So first, we'll start with the SAPS program, or the Substance Abuse Prevention Program, started in 2018 as a result of the Opioid and Substance Use Task Force, i.e. the Fairfax County government and FCPS school board members coming together and deciding that they wanted to have substance abuse services in-house in schools for students. So the Substance Abuse Prevention Program provides all prevention, meaning education, and intervention. Intervention meaning a student has been identified as using drugs. So we provide all of those services to the students, families, staff, and the community. So when you think about our team of 22, we provide the services for 180,000 students, and I think FCPS has close to 40,000 employees, plus the community members, plus their families. So we do a lot with a very small team. So this is just a disclaimer, since we're going to be talking about ADHD and medications in particular. I want you all to keep in mind that I am a licensed professional counselor. So again, that means that I have my master's degree in clinical counseling, which means that I am trained as a therapist, not as a psychiatrist and not as a psychologist. A psychiatrist has a medical degree, and they typically provide the prescriptions for mental health medications. Your psychologist is typically the person who will do testing to help solidify a diagnosis. Your therapists, like your licensed professional counselors, social workers, are the people who are typically doing treatment and talk therapy. So although I am here to talk about ADHD, I am not your or your student's psychiatrist. So I cannot make medication recommendations for you, okay? So let's start with a question, and you all can drop your answers in the chat. So what are the top 3 most widely used substances by youth in Fairfax County? So top 1, 2, and 3. Oh no, it's silent. All right. So, oh, there we go. I had to give y'all a little bit of time. Okay, we got nicotine, Someone said marijuana. I'll replace that with cannabis. And then alcohol. Someone else said the same thing. Very good. Okay. Someone else said nicotine, opioids, and marijuana. Okay, so most of y'all are correct. So number one for us is actually alcohol. Number two is vaping and nicotine. And then number three is cannabis. So usually those drugs end up flip-flopping as far as the order, but those three drugs have been our top three drugs for the last few years that we even looked at our survey data. And we get that information from our Fairfax County Youth Survey that's administered to 6th, 8th, 10th, and 12th graders every single year. What I do want you to keep in mind is that although those are our top three drugs, caffeine is actually the most widely used psychoactive substance. Alcohol is typically the first substance that youth will try when we're thinking about drugs that people deem as problematic, but caffeine is a stimulant drug as well, and it's consumed by about 85% of our US population regularly. So I want you to hold that information about caffeine in your head because it's going to come up again later on. So, social norms is going to be something that we'll talk about a bit. So, social norms is the idea that we need to discuss what's actually happening in our society. So, what's the actual normal behavior? So, youth and adults tend to overestimate the number of youth who use substances. So, when non users learn they are part of the majority and not alone in their opposition to use, they can be more confident in speaking out against use and in acting as active bystanders to discourage the use of others. So that's why I typically start my presentations with the question of what are the top three drugs that youth tend to use. And every now and then people will say opioids. I had someone in a live presentation say crack, and I was like, whoa, like definitely not crack, right? And I start my presentations with that question because just because you hear about something in the news doesn't mean that it happens often. Okay. So things make the news because they are newsworthy. Things are only newsworthy because they don't happen often. And or things make the news for clicks. So to drive your attention to a topic. So when you see that there was a string of overdoses, right? I want you to consider that this is typically isolated, right? So if there were five, knock on wood, overdoses in a school year, that's five out of the 200,000 students that FCPS has. Now, granted, the thing about opioids in particular is that they are highly dangerous due to fentanyl being in the drug supply. So that means that people are more likely to overdose because it only takes a little bit for someone to have a fatal or non fatal overdose. And when children are involved, it makes the alarms go off. But I also still want you to keep in mind that these overdoses do not happen often. And in Fairfax County and the nation as a whole, our drug overdoses have decreased. Okay. So this is just a quote from our overdose investigations unit from the Fairfax County Police Department. So they said that we have not found any fentanyl in THC vapes, so THC being cannabis, marijuana vapes. We have heard these rumors for years, and I know there is some mixed messaging from the DEA on this. I've beat the drum on this for a long time, but we will continue to send vapes and marijuana to the lab should an incident occur where it appears that it can be considered attributable to an overdose. Now, what we do not know is if people are putting fentanyl into their weed as they smoke it. Again, we have not seen cases of this. We continue to tell people that there is a distinction between someone having an adverse reaction to gummies or THC vape pens versus someone suffering from an opioid overdose. Putting fentanyl into a THC pen sounds arduous at best and can't figure out why anyone would do that. But to be clear, we have not seen any of this, but should that change, we will start the notification process immediately. So, again, when you see things in the news about people putting fentanyl into cannabis products, I want you to write that off as probably clickbait. Now, what I want you to also consider is that when um, when dealers are handling drugs, they're not handling it in a manner by which they're trying to maintain the integrity of their product. So, if we know that cannabis is a highly used drug and fentanyl has been on the rise, then you might have someone who sells drugs handling both products. So, there will be cross contamination. So, yes, there has been cases of cannabis being found with trace amounts of fentanyl on it, but an intentional and or deliberate mixing of the drugs doesn't happen because the way that fentanyl is consumed and when it makes sense for fentanyl to be put on a blunt and when it makes sense for someone to try to break open a THC cart and put the fentanyl in there's just too much work when you could just press a pill and then sell the pills. All right, so this is where you all have to get active again. So this is a drug bedroom. So in the chat, I want you to point out everything that looks like it can be related to drugs. So either drug paraphernalia, drug logos, or drugs. Put it in the chat and let me know what you see in this drug bedroom. Okay, very good. I see Perk 30 Jersey. Yes, so Perk 30s are a medication that is a legitimate opioid that is prescribed for pain. However, when dealers are pressing illicitly manufactured drugs, they're going to press the fentanyl into the drugs to make it look like it is a legitimate Percocet 30 pill. So yes, Perk 30 Jersey, 710 notebook, very good. 710 is oil spelled upside down like THC oil. The marijuana socks, very good. You will hear me say you will hear me say cannabis instead of marijuana because marijuana typically only refers to the leaf for one, and most kids aren't rolling blunts or using the plant marijuana. And also, marijuana is a Spanish word, and using a Spanish word to describe a drug um, is rooted in racism because you're implying that only Spanish speaking people use that drug. So I prefer to use the word cannabis because it's the overarching umbrella term. Someone said the socks, very good. The 420 socks. All right. Oh, the Lysol spray, maybe? Exactly. Exactly. Because they're trying to cover up the smells. All right. So here's everything. So the sour diesel poster with the THC strain on it, the Perk 30 jersey, which I got, the Lysol can be used for huffing as well, any type of aerosol. The where's the Molly hat right here with the pacifier, because typically when someone is on ecstasy, which is a hallucinogen, it makes people grind their teeth. The foil, here we go, the foil right here, which is used to make a homemade bowl to smoke the Perk 30. The Houston pillow, which is a reference to lean, which is cough medicine and opioid cough medicine mixed with Jolly Ranchers drink out of a double styrofoam cup. The red solo cup could signify drinking alcohol. Haven't seen this much, but in some like areas, folks will soak tampons in alcohol and then insert the tampon so that the alcohol can be slowly absorbed into the body. The onion, where's my onion? Oh, here we go. The onion on the dark web, which might be how they are getting their drugs. Y'all already said the 710 notebook. The opioid prescription bottle right here, which y'all probably didn't catch. And the book bag with the backwoods on it. And then this little emoji right here could signify that they're the plug, i.e., the person that kids can buy their drugs from. And sometimes they'll have those little emojis on their Crocs too. All right, so what I want you to consider in our time together is that both our genes and our environment help mold us into who we are, whether that be for good or bad. So when it comes to having conversations with your children and or how much you monitor, I want you to consider your own family history of not only substance use disorders running in your family, but mental health disorders and criminogenic behavior. So consider all of those three things and then consider, okay, now that I've thought about this, how am I going to respond? So when it comes to IEP meetings, oftentimes we might hear or see things on the internet where people talk about IEP meetings as if it's like this huge task that no one wants to take on. So I found these on the internet where it's like, this is a parent, they're all prepared for their IEP meeting. And then after the IEP meeting, like they're wore out, they have the alcohol on the side because they drink to feel better. And then this meme right here, if teachers had IEPs on the job, drinking would be part of our accommodations and required by law. So I put this there because if your student has an IEP for their special education services and you view IEP meetings as something that you do not want to engage in, and or you talk negatively about it, be mindful of what your child hears and be mindful of how you manage your emotions after that IEP meeting. Because if you say, woo, I need a glass of alcohol, or I need a glass of wine, or woo, I could really use a beer, whatever, whatever, then you are insinuating to your child that the services that they receive are causing you stress, and you're also um, modeling that that it's okay for them to use something outside of themselves to make them feel better, i.e., that they don't have all the tools within them to manage their emotions. They need to use some other type of mood altering substance. So be mindful of the story that you're perpetuating when it comes to special education. So, nicotine and ADHD. So, ADHD is a risk factor for nicotine use. Okay, so if your child has been diagnosed as having ADHD, it is a risk factor for nicotine use. And what I also want you to consider is if your child uses nicotine, they might have ADHD. Might. Okay. So if your child uses nicotine and they do not have an ADHD diagnosis, you might want to consider, do they have some other stuff going on, especially if you have a family history. So, nicotine is both arousing and calming, and that's because nicotine is a stimulant drug. And stimulant drugs increase your heart rate, increase your breathing because they're going to arouse your system. However, the thing about nicotine is when someone takes a puff of that nicotine, they feel calmer as well. So, again, it's both arousing to the central nervous system and it's calming. So, higher rates of nicotine use, and there are higher rates of nicotine use and vaping in kids that have ADHD versus non ADHD. And what I want you to think about is because nicotine is a stimulant drug and ADHD medications are typically stimulant drugs, might they be using nicotine to manage their ADHD symptoms? So that's why the research out there says if your child uses nicotine, you might want to check to see if they have ADHD because they might be using the nicotine to manage those ADHD symptoms if they are unmedicated. And then sometimes people are a little hasty when it comes to putting their kid on ADHD medications because they're stimulant drugs. We'll dive into that a little bit later too. But treating ADHD early helps protect kids from using nicotine later on. And it helps protect them from developing a substance use disorder. And it helps protect them from any of the criminality associated with their substance use disorder. Now, the kids who have ADHD symptoms, they actually have a more pleasurable experience from using nicotine than the typical non ADHD kid who uses nicotine. And then over here, we see comorbidities of conduct disorder and severe mood dysregulation increases substance use disorder risk in those with ADHD. So, what that means is if your child has a pattern of aggression towards people or animals, destruction of property, theft, or like any other like serious violations of rules and or disregard for other people's humanity, it typically increases the chances of them having a drug problem later on when they have ADHD as well. So cannabis can also be called marijuana, which we've discussed, and weed, pot, dope is typically the flower. There are two main ingredients in cannabis. So you have THC, which is the psychoactive substance, and then CBD, which is non-impairing and it does not get you high. So typically, when folks use cannabis, it's either smoked or it's ingested. So smoked via joints, blunts, bongs, and vapes, and then ingested typically in edibles like a cookie or brownie, a tincture like a oil. Typically, the tinctures are used for medical purposes, like someone who's receiving cancer treatment. So, cannabis directly affects the part of the brain that's responsible for memory and learning, and the brain isn't typically fully developed until about 25 years old. And we know that kids' primary job is to learn. Their job is going to school. So, if they are using cannabis, it's going to affect their ability to learn, retain new information, retrieve any information that has been dumped into their brain as well. So we have all of these areas of the brain that are affected. So the cerebral cortex, which is right here, is responsible for short-term memory. The hypothalamus over here is going to control their appetite. And we know that we've heard of the munchies when people are high on cannabis. And then the cerebellum is responsible for coordination, which is going to make driving, walking, and all of those things difficult. The brainstem, which is going to control the things that we don't have to think about, like those automatic processes. Is for some, using cannabis can make them extremely nauseous, and it's going to affect their experiences of how they feel pain, and it's going to increase their blood pressure. So remember, but cannabis is one of those odd substances because it acts a bit as a stimulant, but at higher potencies. Like usually when someone's using a cannabis cart, the person using it could experience like hallucinogenic side effects. So typically drugs fall into three categories. They're either depressants, meaning they're going to slow down your central nervous system, your breathing and your heart rate. They're either stimulants, they're going to do the opposite, speed up your breathing and your heart rate, or they're hallucinogens where they alter the way that you see reality. So cannabis is a stimulant, but in higher potencies, like 90% is usually what carts are, you're going to experience some are going to experience some type of hallucinogenic effect. And then the hippocampus area of the brain is responsible for memory storage and recall, and then the amygdala processes emotions. So all of that is affected by simply using cannabis. So, this is where things get a little heavier. So, teenagers are already naturally low in dopamine. So, dopamine is that chemical that people say is released. Well, not people say, people call dopamine the feel good chemical. And that's because dopamine is released when we're doing something that feels good. So, typically, our set point of our highest natural dopamine levels are going to be when we eat something that is really delicious, when we have sex, because our brain is like, oh, this feels good, let's procreate, right? Because it's trying to keep our genes alive. Now, teenagers already have lower levels of dopamine. So things like, think about when you're having a conversation with your teenager and their affect is kind of like just blah and flat, right? They're not easily excited by things generally. However, when they do get excited about something, it's almost to the extreme. So when we're thinking about kids who use drugs and the fact that drugs increase dopamine when they are already low in dopamine, and drugs increase that level of dopamine in their body, and drugs surpass the natural set point of how we should feel our natural high, it's no wonder that kids will use drugs. So over here, we have ADHD medications and cannabis, and that is because when someone is prescribed their ADHD medications and they are using cannabis, it is going to affect how effective their ADHD meds are. And then for some folks who use cannabis regularly, remember cannabis affects that part of our brain that controls appetite and nausea and all of that. There's something called cannabinoid hyperemesis. So some kids might experience severe nausea and bouts of vomiting and dehydration as a result of using cannabis as well. And then some mental health medications mixed with alcohol can be extremely dangerous. So if your child is prescribed a benzodiazepine, so Ativan, Xanax, Klonopin, Valium, if they are prescribed, those are the brand names. So if your child is prescribed a benzodiazepine, and they decide to drink, that is a deadly combination because those are two depressant drugs which slow down your breathing and your heart rate. And when you combine two depressant drugs, you have something called drug potentiation, which means that the drugs are stronger together than they typically are on their own. So if you have those drugs in your kitchen cabinets and you're not using them, dispose of them properly so that your child isn't enticed to use any of that and mix it with something deadly. And we just got to my next slide. I did that well. So, up and away, out of sight. She gets her hair from her mom, her eyes from her dad, and her drugs from her parents' kitchen cabinet. So, this is our kitchen cabinet. And let's talk about not our kitchen cabinet, our bathroom cabinet. So let's talk about what might be in there, okay, that your child could use to get high. So we have Robitussin. I don't know if y'all have heard of robo tripping, but when used in high doses, it can cause hallucinations. So it might be called robo tripping or skittling. And then dextromorphan. Um, which is typically in over the counter medications as well, could lead to restlessness or euphoria, or when you use it in higher doses, it could be auditory or visual hallucinations, having issues with coordination as well, and then sometimes mania and panic. Now, Imodium over here can cause an opioid like high at just 200 to 300 milligrams at just 200 to 300 milligrams. So someone could experience an opioid like high from abusing Imodium. And then Mucinex could cause hallucinations as well when you take it at high doses, usually at about 1500 or 300 to 1500 milligrams. And then NyQuil has about 10% alcohol in it. So even if someone is in recovery, meaning they have chosen to be sober from all mood altering substances, they wouldn't use NyQuil because it has alcohol in it and it could lead them into relapsing on their drug of choice. And then Sudafed has been called poor man's speed because it is a stimulant and it's often used when people are making meth as well. And then Benadryl, um, although it's been linked to dementia, when people take it regularly, some research has shown that if you take it in high doses, it can be a problem as well. And then, of course, we have the alcohol bottle down there. The clear eyes can be used to hide the fact that they're using cannabis. So, if your child is prescribed stimulants for ADHD, I want you to limit the supply. So typically, physicians are doing really well at monitoring the dose and the quantity of how many pills they're going to give to their patients. So for drugs that are monitored by the DEA, they might not prescribe anything over than 30 days supply at a time. Back in the day, they used to give people 60 or 90 days worth of stimulant medications or opioid pills at a time. So if you have a 30-day supply, if you want to prevent misuse of that medication, you give your child that medication and you take that pill bottle back to your room, locked up wherever you're going to maintain it. But you be the person that's going to administer that med. And then also do like you're doing today, make sure that you stay educated about prescription misuse and then talk to your child about some of the ramifications of misusing drugs. Make sure that you store medications and keep in mind some of the facts that are out there. So, boys are more likely to purchase meds from other people, so they're more likely to purchase it online or to get it from their friends, whereas girls are more likely to overuse their own medications. And then don't keep a reservoir of medications in your house or send your child to college with like high quantities of that medication. And then tell your child that they should not advertise being on stimulants to their friends because we don't want to create a scenario where your child is inadvertently making it seem as though they're willing to share their drugs with other people. And keep in mind that prescription stimulant misuse is linked to later cocaine and meth use as well, because the ADHD stimulant medication is in the same category as cocaine and meth, which are stimulant drugs as well. So, any questions so far? All right, very good. We'll roll through. So, opioids are typically, and I say typically, prescription pain relievers. And the only reason I say typically is because opioids include heroin, illicitly manufactured fentanyl as well, which are all street drugs. Opioids are not anything that's sold over the counter, so no over the counter pain medication. So, opioids are depressant drugs that are going to slow down your breathing and your heart rate, and that's what ends up happening when someone overdoses is their breath becomes so shallow that their lungs are no longer getting the oxygen that they need in order to survive. So, some examples of opioids are hydrocodone, oxycodone, codeine, morphine, um, Demerol, tramadol. Usually, when you see something that ends in O N E, I've noticed that it tends to be an opioid. Now, again, I want you to keep in mind social norms, right? And things that make the news because they're newsworthy. Fentanyl is not a bad drug. Fentanyl, as prescribed, because it can be prescribed, is a highly effective pain management tool. If you get surgery, and you're put under and they slice open however many layers of skin, when you look in your chart, you're going to see that they probably gave you fentanyl, propofol, all of those amazing opioids so that you would not feel that pain while you are under anesthesia. You want the fentanyl, okay? However, it's illicitly manufactured fentanyl or IMF fentanyl that people are talking about in the news. So sometimes people will say, "Oh, I don't want to be prescribed any opioid drug because that's dangerous and all of that." Depending on your family history, you can keep that in mind. However, if the doctor is prescribing it to you, typically they are prescribing you the lowest dose possible so that you can manage your pain. So, some symptoms of opioid misuse are the three C's, so the loss of control, craving, and then use despite negative consequences. And really, we're looking at the three C's for any type of drug disorder when we're diagnosing someone. So loss of control means that they said, for example, I'm only going to use on the weekend, but their weekend starts on Friday, or their weekend starts on Thursday, right? Or they say, I'm only going to use 2 pills today, and then they end up using four. I'm only going to use after school, but then they start using before they get to school, or they wake up in the morning and then they smoke. Okay, so craving is literally what it sounds like. It's just that preoccupation with using. And then use despite negative consequences means that there has been some negative things that has happened in their life related to their drug use, and yet they continue to use. So opioid intoxication is unique because when someone is under the influence of an opioid, only they are going to experience pinpoint pupils. So, no other drug is going to cause those pinpoint pupils but an opioid. So, their pupils are going to get very, very tiny. There's going to be a reduced level of consciousness, slow breathing, slowed heart rate. The symptoms of an opioid intoxication are actually very similar to an opioid overdose. Of course, it's a thin line between someone being under the influence of an opioid and then someone who has overdose, right? But when someone has overdose, they are simply non responsive. You're shaking them, you're pinching them on the shoulder really hard, you're doing a sternum rub, you're calling their name, shaking them, and they're non responsive. Plus the pinpoint pupils, plus the cold, clammy, either blue, gray, or ashen skin is likely an opioid overdose. Now, the opposite of intoxication is going to be withdrawal. So, withdrawal is when the opioid is leaving the body. Opioid withdrawals feel horrible. So, when someone is using opioids regularly, especially at high doses, they might be continuing to use because they are attempting to avoid the opioid withdrawal symptoms. So, opioid withdrawal feels like the flu times 10 almost, plus something coming out of every opening in your body at the same time. So, like when you see on my screen gastrointestinal distress, right? That is a very polite way of saying constant vomiting, nausea, diarrhea. Their eyes are even running, they're sweating. It's very uncomfortable to withdraw. Those who are most at risk of overdose are those who have a prior overdose history when they have a change in tolerance as well. And that could simply mean that they were in a treatment program and then they completed their treatment program, or they were incarcerated and now they are released from incarceration. If they go back to using that same amount that they once used, they are increasing their chances of overdose because their tolerance has decreased because they seemingly weren't using for the amount of time that they were incarcerated or in treatment. And then mixing drugs, because remember, when you mix two depressant drugs and opioids are depressant drugs, you have drug potentiation. Most overdoses that are happening now are due to fentanyl. It used to be because people were mixing drugs, but now it's typically because of fentanyl. Now, we've talked about pharmaceutical fentanyl and how we want that as prescribed when it's needed for us for the duration of time that the doctor has prescribed it, right? Versus IMF or illicitly manufactured fentanyl. So, fentanyl is up to 50 times stronger than heroin and up to 100 times stronger than morphine. The DEA lab, when they seize drugs, they tested, and in 2022, they found that 6 out of 10% of what they seized contained fentanyl. So 60% of the drug supply that they seized contained fentanyl. And that delicious looking chocolate chip cookie is on the screen because there's the idea of I want you to think of that chocolate chip cookie as a fentanyl pill. I'm looking at my other screen over here. But when you look at the chocolate chip cookie as a fentanyl pill or a pressed pill, right, that has fentanyl in it, you don't know how much of that pill contains fentanyl versus other filler byproducts, right? So when someone uses fentanyl, they might crush up the pill, put it on foil, light the foil from the bottom, and take a rolled up dollar bill or some type of like other hollowed out instrument, and then they're smoking the fentanyl um, from the aerosol that's produced, right? Now, when it comes to that pill, when they crush it up and they smoke it, you don't know how much fentanyl was in it. So just like with the chocolate chip cookie, when you take a bite out of the chocolate chip cookie, or if you were to slice it, you don't know how much, how many chocolate chip pieces you're going to get within that cookie. The same can be true for fentanyl with our pressed pills that kids are using. So we already talked about the overdose signs and symptoms. The one thing that people can use to reverse an opioid overdose is naloxone. So naloxone is the generic name, Narcan is the brand name, and it's a nasal spray, just like the picture up there. You just administer one full press up one nostril, and that is one dose. One box comes with 2 doses in the box, and it will knock the opioid off of the opioid receptor site in the brain, and they will typically within 2 to 3 minutes regain consciousness. Now, typically, when you administer Narcan to someone who has overdosed, they are in distress and they don't know what's going on. Typically, they want to fight. So, you're going to administer the Narcan, wait for 2 to 3 minutes to see if they regain consciousness, back away, call 911 because someone could go back into an overdose even after you have administered the Narcan because the opioid is still floating around in the brain and the Narcan is only effective for 90 minutes. So they could go back into an overdose afterwards. So, in all of our schools for the last maybe like 3 years, I believe, FCPS has had Narcan in every single building, in every single elementary school, middle school, and high school. We have Narcan, and we have Narcan trained folks to administer the Narcan should it be needed in every school building. So back to ADHD. So the thing about ADHD is that kids who have ADHD typically have this highly emotional self-talk, right? So the about 80% of the average person's thoughts per day are negative. So for the common person, about 80% of our thoughts are negative. And then you tack on ADHD to that when they already have emotional self talk, it's going to become difficult for them to manage their emotions. And when you think about the fact that cannabis, right, affects our emotions. And when you think about the fact that opioids are prescribed for physical pain, but our brain has a really difficult time distinguishing the difference between physical and emotional pain. So they might say, oh, well, if I take this opioid pain, which helps with the physical pain, it will also help with the emotional pain because when we're emotionally in pain, our body feels it as well. So again, that's why we say that kids who have a diagnosis of ADHD are more at risk for developing a substance use disorder. So Kids who have autism are actually less likely to engage in drinking and drug use, but when they do use, they are at higher risk of developing problems with substances later on. And that's typically because of that need for routine and repetitiveness. The thing about using drugs is one, you can't control when it becomes a problem for you. And then two, when it does become a problem for you, there is a lot of habituation and routine associated with it. So it could be easier for a child with autism to add that problematic drug use into their routine. And when you think about the lack of suitable support services for kids who have autism, it puts them more at risk. It could make them feel as if it's helping them manage their emotions, and or someone who received a late diagnosis of autism might be using because there's a lack of understanding of their diagnosis or other people understanding their diagnosis, and again receiving support. And then if there's some other type of like co-occurring physical and mental health conditions, it could put them more at risk of developing a substance use disorder as well. So when it comes to substance use disorder and ADHD treatment, so this is the part where we're going to talk about like ADHD medications a bit more in depth. So giving ADHD meds to children helps reduce the likelihood that they will use cannabis. Okay. So sometimes people do not want to give children stimulant medications because they are fearful that their child is going to become addicted to that stimulant medication. But children's brains, because they're still developing until 25, um, up until about the age of 12, their brains are very neuroplastic, is what it's called, meaning that the brain can easily change and adapt to situations. So when children are prescribed stimulant meds for their ADHD prior to about 9 years old, it decreases the likelihood they are going to have a substance use disorder. So prescribing stimulant medications to children to help them manage their impulses, and we know that substance use disorder and or addiction is a problem with impulse control. When you prescribe stimulant medications to children that have ADHD, it helps them with their long-term planning. It helps them control their emotions so that they don't have to use illicit drugs out in the street. And when you prescribe stimulant medications to children that have ADHD, it helps them assess risk a bit better as well. Because what's happening with those medications is it's releasing just enough dopamine for them to focus on the things that they need to focus on. It's helping them become more engaged in what is typically boring. Because that's the thing about ADHD is it's not a problem with lack of attention. It's just that kids who have ADHD only focus on what's interesting to them. And we know that school and being an adult requires us to focus on things that might not be interesting to us. So when you prescribe that stimulant drug or that ADHD medication, it's helping them increase their focus on things that they need to be focused on. So stimulant misuse actually peaks around 21 years old and or when kids are in college. So typically when people are misusing stimulants, it's because they are trying to enhance their attention either for work or for school. So treatment of ADHD early reduces the risk of substance use disorders later. If misuse of drugs is less severe, meaning if we have ADHD and a drug problem, if the drug problem is less severe than the ADHD, then we are going to want to treat the ADHD and the drug problem at the same time. If drug use is more severe, then let's go ahead and address the substance use disorder, okay? Because we got to make sure that you're living so that we can then treat the ADHD. And we want to make sure that we're treating the drug problem and we're tackling some of those thoughts around the triggers and the cravings of drug use. Because if then we prescribe the stimulant medication, we want to make sure that they're not misusing their stimulant medication. And then, if someone is unable or unwilling to address their drug problem, then CBT, which is a type of therapy called cognitive behavioral therapy, and non stimulant drugs or extended release stimulants are what's recommended. So the non-stimulant drugs are less habit forming and the abuse potential is less. And then extended release stimulants, meaning typically when people are misusing their stimulants, they're using the immediate release stimulants, meaning you're going to almost immediately feel the effects, versus an extended release is meant to last upwards of 24 hours. People are typically not abusing that medication. So if someone is unwilling to address their drug problem, then the psychiatrist might recommend talk therapy and non-stimulant medications or extended release stimulant. And then just be cautious if you know that your child is on a immediate release stimulant medication for their ADHD. And this is just a quote that I pulled from someone who has ADHD and a substance use disorder from YouTube. So this is just a testimonial. So this was a neuroscientist and a Harvard professor talking about substance use disorder and ADHD treatment. So he said, I have ADHD and a substance abuse disorder. When I'm on my medication, his stimulant meds, I am probably 60 to 80% less likely to want to drink. When I'm not on my meds, it's like an uncontrollable urge to change my state of mind and I spiral out of control. Even though stimulant meds are a controlled substance, I've never had any desire to abuse my medication. It's crazy. And I want you to think about it this way: when you are taking care of yourself, meaning you're well rested, you're eating well, you're physically active, it's similar to when a young person is on their medication. Okay. So when you are taking care of yourself, you are less likely to engage in dysfunctional behaviors. So when you're well rested, you're eating well, you're working out, you're moving your body, you are less likely to mindlessly scroll on social media. You are less likely to overeat. You are less likely to overconsume caffeine. So, again, when a young person is on their ADHD medications appropriately and taking care of themselves, they are less likely to abuse drugs. So, it's just the same thing for all of us. So when someone is misusing their stimulant medications, typically among college students, they're 99, not 97, 79% of them are using it to concentrate and to focus. 62% are using it to stay awake. 56% using it to reduce distraction. 48% for more energy, and then 42% to experiment. So, among the college students that end up misusing their prescription stimulants, 55% of them are taking it orally, and then 40% of them are snorting it. And remember, the immediate release stimulants are the preferred stimulant drugs that they are using to get high. So these are just some ADHD reminders. If you notice that your child is overthinking, encourage them to write so that it can slow down their thoughts and write by hand, not on a computer with various distractions or on their phone. When they're feeling anxious, encourage them to meditate. If they're tired, take a power nap. I had to do that yesterday. I literally, because I have a 1 year old now, and you know what that means. I'm exhausted all the time. So I remember saying to myself, I have 2 hours before my next big thing. Do I want to take a nap or do I want to have a cup of coffee? Right? So do I want to take a nap or do I want to use a mood altering substance? I said, let's take a quick power nap. So that's exactly what I did. So when your child is sad, encourage them to exercise so that they could get that natural dopamine release. If they're stressed, encourage them to take a walk. If they are angry, listen to music. Feeling lazy, reduce screen time. And if they're burnt out, go read a book. So, what tends to work for those who have ADHD is sleep, medication, plus cognitive behavioral therapy and family therapy. It's so interesting because the same thing that works for ADHD is the same thing that works for a young person that has a substance use disorder. So, Cognitive behavioral therapy and family therapy are recommended when a child has a substance use disorder. And then those who have ADHD are interest driven, meaning what they're interested in, they almost have like this hyper focus. They can really hone their attention into something that they care about. Whereas with us as adults or people who don't have ADHD, we're more importance driven. So in our mind, we might have a checklist of things that need to be done. And we're like, okay, well, this is important. Let me go ahead and tackle that. Whereas kids who have ADHD, they're not worried about if something is important or not. They're focused on what's interesting to them. Now, let me go back to sleep. The thing about sleep is not just the quantity or the number of hours of sleep, it's the quality of sleep that's important as well, and the timing of that sleep. So we know like some people are early risers, some people are night owls. So if you know, think about yourself, if you know that your body tends to prefer 7 to 8 hours to function well, you can't say, if you're an early riser, well, I'm going to stay up until 11 p.m. and I'm just going to wake up at 7 a.m. instead of my usual 6 a.m. No, that's not how it works, right? If you are an early riser and you know that you tend to function better when you go to bed at 9:30, then you need to go to bed at 9:30 and stop scrolling on your phone late at night, because it's the consistent quality sleep and the timing of the sleep plus the duration that all affects our circadian rhythm. And people don't typically have a sleep problem. We typically have a problem with shutting off our arousal. And shutting off our arousal states is what helps us have a better regular bedtime. And it's important for us to think about the quality of sleep for our kids who have ADHD, because unfortunately, a diagnosis of ADHD has been shown that those folks will have a 10-year shorter lifespan. And that's because when you add in how distractible they are, so that distractibility, how easy it is for them to lose focus, it can lead to accidents. And then when you combine that with the impulsivity that is related to ADHD, they are less likely, it's harder for their brain to apply the brakes, not the brakes in a car, but the brakes in slowing down their thinking. So with prevention of drug misuse, I want you to have many small conversations. So instead of having one drug talk, I want you to have many small conversations about drugs as it naturally comes up. And I don't want you to use that whole, if you drink or you use drugs, you're going to die or go to jail. Because for the vast majority of folks, they're not going to die and go to jail. So I want you to educate yourself about how to have effective conversations with your kids about drugs, and that'll be in the resources that I send to you all. Make sure that your kids are involved in activities and that you become involved in the activities that they are engaged in. Monitor their prescriptions, eat meals together, because eating meals together and spending quality time with your children so that you can lay eyes on them and show them that you care about them does reduce the likelihood of them using drugs. Dispose of any unused medications. Fairfax County Police Department has drug take back days 2 times a year. We have one coming up next month where the police stations, you just drive up and you drop off your unused medications and or drugs, and they don't ask any questions and you can pull off. But also, if you miss a drug take back day, our police stations have a drop box. You just walk into the police station, drop your meds off in the box, and then you can leave. Avoid flushing your unused medications down the toilet, because we are not trying to contaminate our water supply. And then make sure that you supervise the medications, lock up any meds or alcohol. You can get med lock boxes like the one here from the county, which will be listed in your resources. And then also prepare your child for reality of, if they are on meds and their friends find out about it, how they can say no to their friends, essentially. And then when it comes to protecting your children, we have something called protective factors, which means that they're the things that keep us from engaging in quote unquote risky behavior. It helps us manage our stress, make better choices, and develop healthy habits. So when kids have at least three of these little checkbox items on the screen, they are less likely to engage in drug use, criminogenic behavior, and other things that put them at risk for their health and safety. So when kids have a parent or guardian who's available for help, when kids are participating in after school activities, when kids have an adult in the community to talk to, when they accept responsibility for their actions, and when they have teachers who recognize and praise good effort, it all helps them manage their stress, make better choices, and develop healthy habits. And when you look at that list, all they need is three. And when you look at that list, the root of it all is simply connecting to another person in real life. So this will be sent to you all. These are just some past webinars that might be helpful, and it'll have some local resources and then some national resources for you all.